Assalamu alaikum. Today I will discuss the algorithm of the COVID-19 patient in ER, how we will approach the patient who come with the COVID-19. Mostly these patients appear with the two conditions. Number one is non-acute hypoxic respiratory failure and second is the acute hypoxic respiratory failure. In this video I will only focus on the algorithm of acute hypoxic respiratory failure and how we will approach this patient. Whenever a patient comes with acute hypoxic respiratory failure, we will isolate this patient and perform HRCT. HRCT gives us the two type of information. Number one, the patient finding may be typical or indeterminate. So in this condition, we have to isolate the patient and send PCR and start full precautions. And we have to wait for the COVID PCR result, and the result may be positive or negative. If the result will be the positive, then we continue the isolation, and if the PCR is the negative, then we have to send again PCR, and when the two consecutive PCR will be negative, then we will isolate the patient. So now come back to the HRCT finding. If the finding will be the atypical, so we will again send the PCR, but no need of isolation at that time. Then PCR finding may be positive or may be negative. If the PCR finding will be the negative, we will remain de-isolated, and PCR post, if the PCR is positive, so we have to isolate the patient. So this is the basic algorithm for the management of the patient who come with the acute hypoxic respiratory failure in emergency department.